Thank you. And my other question is, I know it's not, it's a temporary, naloxone is a temporary relief. Do you agree with that? Like it's available to remote, rural, northern, and urban communities? So is he accessible?
Is it currently accessible?
Yeah, to all the communities with, if they want it, rural, urban.
Well, I don't know absolutely, but I assumed it was. Yeah, it's.
Okay, there's no barriers.
It's not a prescription drug.
Yeah, but
Right.
there's no barriers. It's easily like.
That's right. Yeah, I mean there's a cost.
Okay. And as we heard, the overprescribing of fentanyl is. Do you think this question is to my CPA? Do you think overprescribing fentanyl is the opioid is contribute to opioid crisis?
I think the vast majority of the fentanyl that's causing this problem is not coming from traditional fentanyl patches that you would see for treating patients such as cancer patients. The majority of this is coming from outside of Canada, tablet form, and it's slipping through, and unfortunately it doesn't take much of fentanyl to be able to provide these people with euphoria, and the majority of it is coming from external to this country.
Mm-hmm. So as we heard, as the number increased to prescribing these fentanyl, so why this is the increasing number of the in the prescriptions?
There was an increase in the opioid prescriptions. I'm not 100% sure if it's fentanyl. Is it morphine? Is it hydromorphone? I'm not 100% sure on that. Mm-hmm. Personally, from my practice, I have not seen an increase in fentanyl being dispensed, but I can say from talking to law enforcement that we're seeing an increase in synthetic fentanyl from outside of the country. That's primarily where it's coming.
Thank you. And can you speak on the drugs? Like we heard from the witnesses who came before, they said telling someone it's a strong drug makes people want it more. They want to look cool. Can you elaborate on that? Is this a fact?
Sorry, could you provide some more context on that, please?
We have a witness before here, and they said telling someone it is a strong drug, the fentanyl, that's why people want to look cool. Is that the fact?
Oh.
Any witness?
I mean, I can certainly say that in my own practice, I've never used the word strong drug for, coming across to a patient. I say it's this is going to provide significant or a lot of pain relief, or it's a medication that we have to be careful with. But when we counsel our patients day in and day out, we want to make sure they're fully educated on the particular medication. Mm-hmm. And if it does seem that it's an inappropriate medication, we consult with physicians and prescribers to make sure that we keep patients safe.
Time's up.
Thank you.